Welcome to Zon Academy, everybody. I hope you're having a great day out there. We are here with Dan Alter, so we're having a great day. And Dan is
Uh-huh.
here to discuss maximizing your 3D printing with Zirlux print resins. Okay, we're going from models to night guards and more, and Daniel's going to show us how. Daniel is an MSc, MDT, CDT. He's the editor of IDT Magazine, as well as professor of restorative dentistry at the City University of New York. And we are so happy to have him back again on Zon Academy. Thank you so much, Dan, for joining us.
Thank you, friend.
I want to let everybody know that Dan will be having a live Q&A at the end of his presentation. So please, if you have any questions, just type them in at the bottom of your screen at the Q&A section, as well as poll questions. We have some poll questions that Dan has prepared. And if you wouldn't mind when I pull them up, just taking a moment to answer them. I have one coming up right now, so I'm going to launch that. And right now, Daniel would like to know, are you currently 3D printing in your laboratory? If you wouldn't mind answering that, and we'll keep it up for about 30 seconds. But Dan, thank you so much for joining us. I
Thank
hope
you.
you are ready for this great weekend ahead, and I hope all of our listeners that are dads are as well. And whatever, whoever you're celebrating, we hope that Sunday's a great day for all of you out there.
Awesome. Thanks.
So Dan, I just want to let you know that the polls are, rushing in. We have 60% of our listeners that are 3D printing and 40% are not as of yet. So they're going to have some great information from you here.
Fantastic.
So I'm going to turn this over to Dan, everybody. Enjoy.
Awesome. Thank you so much, Fran. Thank you, everyone, for joining us today. It's both an honor and a pleasure to be here, sharing with you all and really being the ability of advocating for as what my entire career has been for the dental laboratory and making things that much better. And this, what we're going to discuss today, is one of those that it's going to be a technology, a material, but also the ability to look outside the box, for lack of better terms, right? Because that's where I really believe the sweet spot truly is. I mean, we're as a profession, we've already proven the fact that CAD/CAM digital technologies, both the software as well as the hardware, are certainly there, and we're able to produce a significant amount of things that we weren't able to or couldn't even contemplate perhaps 10 years ago. And now we're able to do it in a consistent and repeatable process. But what does that mean? How do we absolutely do that? Material science is a part of technology, which I'll also speak to as well. But can we do it differently? Can we use it differently? The answer is yes, right? And you'll hear me say it, and I say it oftentimes, where just because we've done something for 30 years one way doesn't mean we need to do it exactly the same way for the next 30 years. And in fact, what I'm going to show you today, and this is a apropos kind of topic about it, is what can we do things that will make things better, that will serve our dentist clients better, and ultimately their patient, and thereby us as a dental laboratory community. And the opportunity with technology and material sciences that we're going to be discussing today is really an opportunity to really excel in the greatest of way. So just to kind of refocus that, one of the things that I live by, and one of the quotes is, it's not always what technology does to us, it's in fact what we do to technology. And I have a caricature here, and you can see on the left-hand side, this, and with that said, full transparency, I've been oftentimes, and I'm sure many of you have been this gentlemen, where we're carrying the technology. The real of what we're doing and what we're going to be discussing today is how can the technology carry us? Because that's really where the benefits of technology. If you're finding yourself, and again, I found myself, and many of us I'm sure have, where we purchase technology and now we're doing more work, we're doing more kind of wraparound in order to get to the end result, is the technology really something that is better, right? Or is the technology more a better workflow, a better outcome? So not only am I looking at technology in a way that, which we'll discuss today, is the ability of doing something consistently and repeatably while being able to scale it in a great way so that there's a revenue stream. But I also look at technology in many ways with what else can it do? How else can it continue to resonate for the laboratory and grow the laboratory and ultimately help more along the way? Like I said, Ultimately the patients. I really do believe that the standard of care is significantly better. Our dentist clientele, which we'll talk about how to help them in their businesses as well, which ultimately trickles back down to our laboratory. So not only do I want you to be more in the technology as these two gentlemen, but the ability for the technology to really carry us. And that's what brings us here. And I'm glad you all joined us because this is an opportunity to really dial in. Now, I have to say that there's a lot of opportunities within what we have, and certainly in this topic. And today we'll be talking about the Zirlux portfolio and specifically the resins. But you're at your disposal, and that's something that is really completely relevant to what it is that we're doing. Because not only is it the technology that allows you to do more, but it's also the competitive edge, right? I tell my students at the university oftentimes is that CAD/CAM, and I kind of encompass all the technologies that are digital in that, is I call it a very sophisticated dumb machine. It's very sophisticated because it can do geometries and materials and solutions that 10, 15 years ago we couldn't have even imagined. And now we're able to do it consistently and repeatably. And the reason why I call it a dumb machine is because why? It's a tool that you'll see that really only works as well as it works with what I call dental intelligence, which is what we all have from years of knowledge and experience and so on. We know what is viable in the mouth. We know what will work in the mouth. Now we have a tremendous tool to get us to that end result quicker, better, and more consistently. So now we're able to do that, but then we're also, what I'm going to show you today is the ability of really stretching that and stretching those results to do things that perhaps you didn't have before. And the competitive edge is what your dentists have grown to expect from your laboratory. That's why they come to your laboratory, right? So when you're introducing or adding another technology, again, it may be software, hardware, or material, you want to make sure that that technology is what carries you forward, what progresses you, and what allows you to do more, achieve more, and have a better, more consistent, repeatable outcome. And there's plenty of technologies out there for that. So with that said, I'm a big believer in knowledge is power. Knowledge shared is power multiplied, which is why I'm happy we're all here. And that's, in my opinion, the key to success. And I think as we're seeing now in the market, I mean, digital technologies is certainly something that is not going away. It's something that it's only going to become stronger because it's proven itself that its ability to do so and be able to help the laboratory accomplish significantly more. So with that said, CAD/CAM technology benefits, as I said, it's a very, very powerful tool. I mean, my God, I'm doing things today that, with bars and implants and so on, that were very, very difficult to do 10, 15, 20 years ago. But now we can do that with a great level of efficiency and precision to 25 microns, the level of complexity, and most importantly, consistency, right? Whether it's a Monday, Wednesday, Friday, whatever the case may be, whether it's, as I'm going to show you, in the middle of the night, whatever that output may be, and you can have multiple decisions as to what you want your laboratory to kind of process and operate. And you can do that. You can do that with the technologies we have. Again, you want the technology to carry for you what your laboratory business is. So having the ability of doing so and having the ability of really creating something that is outside the box, something that is not the typical of what we've done certain things for 30 years, but what can we do and how we can excel. Right? If all you're doing is getting a piece of technology to duplicate and do exactly what you've done for 10 years, does it really make sense? Yes, it may make sense because we can do it consistently and repeatedly, but you always want to look at what could it add to your business? What could it add to your clientele? What could it add to your clientele's patients? I mean, that's where you want to really think along outside the box. And I promise you, and I'll share with you two or three different types of things outside the box that you can do immediately come tomorrow morning. But nonetheless, there's so many others that if you just kind of take a step back and think about it, yes, you can fulfill your needs of today. But what else could it do? Could it do something could it offer a product or a service that perhaps you haven't been offering? Is your dentist clients currently sending to a different laboratory only because you don't perform that service? You may have the software, you may have the hardware, you may even have the material. and you're just not thinking of doing that service. And my question to you is, well, why not? So that's where you really want to think along with technology. Not only, again, I can't emphasize this enough, not just the software, not just the hardware, not and certainly not just the material. It's all three that can really proliferate and allow you to do a lot of things. So, for example, one of the things that I believe in, and it's going to be the next segment, is the intraoral scanning, which I think over now soon enough there's going to be every patient that goes into a dental office will be required to do an intraoral scan. Now it's going to be something as a standard of care. I do believe so strongly because it's going to help us down the road be able to recognize and identify perhaps anomalies that haven't been there. So what do I mean by that? If a patient comes into Dr. Jones and gets scanned every time, they come in every 6 months, hopefully, if not once a year. Over the course of 3 to 5 years, those scans could become stitched one on top of the other or looked upon up top of the other, easily recognizing if there's an anomaly. And I shouldn't say easily, but having the ability of recognizing as an anomaly, which is a little bit more difficult for a clinician to be able to recognize it or identify it if the patient presents themselves only once a year. They have x-rays, they have other things, but now you can have a real scan that could quickly and easily with software identify if there's something, an overlay or something different with that. So I really think that's one example of where we're going with, an increase of standard of care for the patients. And it's again something to kind of prime your mind into thinking that it's not just an intraoral scan where we replaced impressions. Yes, we've done that too, but look at all the benefits that are provided thereafter. And that's what I absolutely love about technology. And I really encourage you to think along that way. So with that said, the first things first is where it's this is also the patient experience, right? So patients have grown to expect this from their dental offices. And thereby they're also inferring that the dental laboratory should be as high tech or as digital as it is. And they're just under the assumption that if they're going to dental office or clinician that is utilizing digital technology and utilizing, high tech equipment, that so will the laboratory. And it's an opportunity for us to really be able to do that. But with that said, it also changed in a big way the way dental folks and those that are especially are concerned what the dental experience is, and that's really has proliferated in a great way, and patients have become very savvy. And in fact, they're coming into the dental office now with, I don't know if you've heard of this new thing that's out there, it's called Google. I'm just teasing. But patients are actually going on Google and searching, and now with ChatGPT or whatever have you, and present themselves at the dental office with knowing exactly what kind of technology, what kind of and so on and so forth. They come to the dental office already asking for products by name. So these are the type of things, and it's a new different type of patient that presents themselves at the office, and we need to be mindful of that. So now, with that said, again, the patient experience has dramatically changed to what was. If you look at the left, and it's a video that we've seen where it's typical of what a lot of patients think a dental office visit is. So needless to say, as you can see, just for the sake of time, I mean the experience overall, the patient, especially those that are dental phobes, it's a quite drastic difference between the left side and the right side. And again, the left side, there's still some clinicians that are doing a lot of impressioning, and there's less and less, but there still are. And certainly 10 years ago, it was the bulk majority of them. So the patient's expectations are considerably different. And look at the experience overall. Put yourself in the patient's shoes as what it is as it's illustrating on the right hand side. It's very high tech, and it opens up larger than life and other AI tools and other scaling tools and so on and so forth. So technology is something that can really help us move things forward. And there's more information than we've ever had before and more data. And this is what's also going to lead me to an opportunity to share with you all is for the laboratory, because I think that the more data that we have at our fingertips, the better decisions, the better outcomes we can provide. And also the more we are in our driver's seat. So whether it's an X-ray, whether it's a cone beam scan, or whether it's face scanning, especially for within the implant world, it allows us a tremendous amount of data to incorporate it so that we then become more so in the driver's seat. And 3D printing is leading the way. So now, I was recently and also at a conference, and this number came up, and it's true. Where in from 2024 to let me just put to 2030, the worldwide market of just dental 3D printing is anticipated to be about $3.1 billion. Okay, and that's at a pace of 26.4. Now, with that kind of, and 2030 is what, 4 years away. So you can imagine the opportunity, but a lot of that is going to be some of the things that we're discussing today. It's going to be new products, new services, new opportunities to expand, and that 3.1 billion is truly a dental 3D printing market. Now, mind you, I do think it's a little skewed because it also has equipment in there, it also has resin cells, but nonetheless, it's a figure that definitely you want to pay attention to because it's an opportunity and you shouldn't be letting it slip your fingers by because that's really if you're in the dental market and if you're not 3D printing yet, I would encourage you to seriously contemplate because that's where everything else is moving along. And if you're 3D printing today and you're doing things like models or whatever have you, at the end of this conversation, at the end of this lecture, my hope is that you'll be able to see, because technology, in my opinion, should be running 24/7. So it's like one of those where we always dream of making money while we sleep. Well, we have the opportunity now where we haven't had before, and I'll share with you what that is. But it's a big opportunity within the 3D printing, and I encourage you to first look at how to be at the bleeding edge or the cutting edge of what technology is, because it'll allow you to not only become that expert in the geographic area, but also allow you to figure out all the nuances while everybody else is waiting on the fence trying to see whether or not this is something that's feasible or not. The person that's there first, the person that's running ahead, the person that's figuring things out is, the one that tends to be the more successful because you're the first mover and shaker and really monopolize that market. So 3D printing and certainly milling is of importance, but 3D printing is something that is really separating from the pack, and it's something to really recognize. And you should not only recognize it, but also contemplate what is the best way for you to tap into that market and reap those benefits. And certainly a 3.1 billion, if we can somehow get even 1% of that, I think we'll all be very happy with that. But it's an opportunity to certainly do that nonetheless. So the things I'm going to be speaking to about today and within 3D printing and within the Zirlux portfolio resin, which again, I'm really, honored, and I was very pleased with the opportunity when it was first to test it before it came to the market. And one thing that I have to share with you is that I was blown away and of how easy the post processing, because with 3D printing, oftentimes one of the painstaking challenges with 3D printing is the post processing, making sure that it's clean, making sure that the part is exactly the way we want it. There's no residual resins left or anything like that. Well, and I've worked with plenty of resins, and certainly this resin set itself apart because it appeared to have been so simple and so easy that just washing it with the IPA and then final curing was more than 99% of sufficient. So it just needed a little bit in one of the parts that I remember, just with a little bit of air just to blow it out, a little bit of resin that was kind of hiding or tucked into the corner. But otherwise, it was just the post processing was almost negligible and the parts really came off very easily. So it's something to really, really, to pay attention to. And again, I'm glad to have tried these and worked with these, and I'm still working with them. And these are the ones we're going to highlight today and for our talk. So it's to develop a new line and opportunities for growth. Keep in mind, I'm looking at this as yes, it's a means to be able to fulfill your needs of today, but how will your needs of tomorrow may change, or can we add more revenue streams? And the answer is yes. So what we're going to be talking about today is surgical guides, which is a huge opportunity. Night guards is an even tremendous And I'll share with you what I mean by that. And then models for smile, design mock-ups, and implant models with gingival masks. So these are the four types of resins, and there'll be more coming on board. But again, with Zirlux and with Henry Schein's brand, they vet and make sure that the what the product claims to do is what it truly does, and that's why they're rolling out. But they rolled out these four opportunities for us to be able to reap the benefits and the revenue right off from the start. So I'm a big proponent with virtual planning implant and surgical guides. There's a surgical guide resin that is truly, and I'll show you some samples of how it prints, and it's so pretty, it's so clear in color, and you can choose what you want to do. But if you're not currently doing any implant planning, I highly encourage you, whether you use 3Shape Implant Studio or exocad's exoplan, this is an opportunity truly for every laboratory to be able to engage even more meaningfully and more strongly and more impactfully with not only their existing clinicians, but also an opportunity to attract new clinicians. Because truth be told, especially for single, restorations of single implant sites like this, who's placing the lion's share or the majority of these implants now? It's our general practitioners that are trying to bring more revenue into their clinical office while trying to be able to service their clientele in a greater way rather than outsourcing it. So if there's a huge need and a huge want, and certainly our general practitioners who are the bulk of who our laboratories clients are, to me, it makes perfect sense to be able to collaborate with them, plan out these surgical guides so that they can do where, and again, this is just a term, hopefully not, but literally with their eyes closed. So we can create a surgical guide, and here I have an example of how I created it using Implant Studio. But all we're doing is it's restorative centric, and now we're able to place that implant exactly where it is so that we get the outcome that we're looking for. So it's not going to affect the aesthetic outcome. It's not going to affect the functionality of the outcome. We have a lot more liberty of placing the implant exactly where it would give us or yield us and the clinician and ultimately the patient with the best results, the best outcome. So that's what I really enjoy about, whether it's 3Shape Implant Studio or Exoplan, because we have the ability as a laboratory to elevate our clinicians, help them restore more implants. And granted, in the beginning, it may be singles, but nonetheless, that's a revenue stream that if they're not tapping into now could be substantial. And they'll always recognize the fact that it's their laboratory that helped them through the way. And ultimately, when you're engaging in surgical guides, as you see here, you're in essence already owning that restorative case. So that case, is going to come to you because you already pre-planned it, you already created a surgical guide. It's going to work incredibly well as long as you know the landmarks and so on and so forth. And then the restorative is just everything that was worked out before, just facilitating or fabricating the final restoration. So it's really, really a remarkable process for a dental laboratory. And if you're not engaged currently with it, I would highly suggest exploring it because it really opens up a plethora of an opportunity for a dental laboratory. And it really is truly very, very easy. With the implant, planning, you just have to know, some landmarks like the mandibular nerve, the sinuses, where the bone density is. And again, if you're shown once or twice, it's an easier process. Prior to you doing a surgical guide, a licensed dentist has to sign off on where the implant placement is. And then you go ahead and you actually design the surgical guide with windows. You can use metal sleeves, you can use glue, you can use a lot of, and obviously with seating windows, but you have the opportunity to do so. Now, so I just shared with you the general practitioners, and obviously you can go to a toozer, or for lack of better terms, or a two implant. Again, the same process applies as you're graduating your general practitioners, as they're doing more, as they feel more confident with you at supporting them, they will be doing more and more, and thereby you're getting the restorative cases too. So it's a great way of building that camaraderie, that building that client loyalty, if you will, because we're no longer competing over a price or a race to the bottom. We're competing over great value. You're bringing them an opportunity to create revenue stream, to offer their services greater to their patients rather than having to outsource it. So the collaboration with the dental laboratory, and especially one that uses the resins to print 3D printing surgical guides, you have the ability of really reinforcing that and creating that for your clinicians, thereby generating a greater revenue, where thereby the laboratory gets a greater revenue as well. So it's something that is really, really remarkable. Now, one thing, as I shared with you with the general practitioner, is another opportunity for dental laboratories to really harness is oral surgeons. Because oral surgeon, depending on your geographical area, have anywhere from 50 to 5,000 referring general practitioners to their where they outsource implants or anything like that. Now, just imagine the oral surgeon is Dr. Smith and the general practitioner is Dr. Jones. And Dr. Jones calls Dr. Smith and says, the implants are perfect. Which laboratory should I send the restorative work? Where do you feel more comfortable so that this comes out as perfect as the surgery? Obviously, Dr. Jones is going to say, well, I use lab XYZ. That's who should be doing the restorative because they've already figured it all out. They're in the driver's seat. Everything is coming right through, and you're going to have the best results. So the amount of volume or business that you could attract from working closely with an oral surgeon by just offering them the support and the services can really propel a laboratory in the greatest of ways. And it's not limited to just ones or twos. Obviously, you can do a full arches and everything in between, as you see here. So these are the Zirlux surgical guide resins, and it's truly a remarkable. It has a high accuracy. It is in the family of the Zirlux portfolio. It's a surgical guide resin. It's a rigid, biocompatible, class 1, 3D printed resins. The nice thing with these resins is that they've truly went out of their way to have a very extensive printer validations to the point that they make the claim that any dental 3D printer is validated with this materials because they've done so. They've checked it, they've verified, they made sure that it's valid all the way through, and that's why, making sure that you follow the IFU is really important. But for this particular, surgical guide resin, which is clear, it's highly accurate, which is exactly what we need of about 50 to 25 microns. I think some, gets even, but it's perfect for guided surgeries requiring that exact fit in implant placement. As I said, it's biocompatible, it's durable, extensive printer validation, and it also is very easy to polish as well as autoclave. But what you get is results like this, which has a slight little bluish tint to it that does become clear, but you get that incredible results. And I use the Asiga here, as you can see, for these two surgical guides. So planning it, using the STL, making sure that it is properly enforced or supported, I should say, and then printing it is a, depending on the printer, it could be anywhere from a 15 to 35, 40-minute print. And then you have a viable product or service that you can provide that clinician and charge for it. But ultimately, you end up getting that restorative work, which is what is really remarkable. So you're able to help your clinicians, you're able to help your patients have more consistent and repeatable and outcome while generating revenue stream and also pointing that restorative case to your laboratory for that final case all the way through. So a surgical guide, if you're not doing surgical guides now, I would ask yourself the question as to why and should you? The answer is yes, I feel like you absolutely should because it's an opportunity to, again, provide a business model for your client dentists currently. If they're not offering any implants, especially singles, molars that are fairly simple to do, if once shown, this is a revenue stream that they can offer and now offer that for their patients as well. So it's really something that has impacted my laboratory and has impacted others in a great way, where it's a low lift and easy, and again, getting clients from our own existing client pool is fantastic, but also realize that it's going to get more clients through because every one of these dentists have study clubs, have a network of friendships and what have you. And when you're helping them and are successful with that, they tend to sing your praises and you'll get more new dentists coming through. So it's something that I definitely encourage everybody to do it. And it's just a matter of if you're currently 3D printing, it's just a matter of adding a new resin and if you're not familiar, a slight little training Again, nothing too crazy, but you're within a 2 to 3 hour training, you're able to fabricate these 3D printed surgical guides and offer that value in a great way. Another great opportunity is with night guards. Night guards is something that I really, really am excited about because it's something that we see that prior to 2020, 20% of all patients visiting dentists receive night guards. Now that same number is at 80%, if not even higher. Obviously, we had something happen between 2020 and 2024. You might have heard, you might have remember it's called pandemic, COVID, so a lot of more stress, a lot more things. But I also think the standard of care has changed where it's not only the paranormal destructive forces of Bruxers, which we're documenting significantly more since 2020 than we had prior, but also the restorative. In night guards, are myself included, I'm wearing a night guard now for the last 2 years that I haven't worn before, but it's truly something that is deliverable every year in a great way. So going from 80% to 20%, and eventually it may get close to that 95 to 100% because it's $5 worth of resin can protect a tremendous, full mouth reconstruction or even natural teeth in a great way. So I think some labs are doing it as a service where they're adding it to large cases, or perhaps they're offering it as a revenue stream. But this is a great opportunity for laboratories to really reap the benefits. But the U.S. mouth night guard market alone was valued at $670 million in 2022. Now, indicating a significant number of night guards are sold annually. The replacement rate, depending on how paranormal function is about 2 to 5 years. Some I've seen as little as 1 year. And now I know the insurance cover, dental insurance, is looking at covering, portion of it or not, or covering them as a whole. Now, this is something that really is a revenue stream that could be done. And as I promised you, I'll share with you how, our dream of being able to make money while we sleep is truly possible now. So there's with mount guards, and I know several laboratories that are doing this where they either use outs, either they're designing it in-house in the laboratory, which again, an accomplished designer could do it in about 5 to 10 minutes, if not even less. They also have AI options, outsourcing options, including the Henry Schein design services that could do a guide for you. But nonetheless, what I would suggest if you want to do completely turnkey and hands off, where you literally are sending it out for, it's a under double digit as far as cost, depending on where it is that you're sending it out to. You're getting it back. You're nesting it into your software. And in fact, this weekend I heard that there's ways of allowing those outsource partners of yours nested into your printer as well. Then you go home and it prints overnight, and you come into depending on your build plate, depending on your printer, depending how many printers you have, but you can come in the morning to thousands of dollars of revenue or products sitting there waiting for you, and you didn't even have to do a thing. It's truly, and with the Asiga, I'll show you, it makes it even that much easier to be able to do that. But imagine, just accepting cases or having cases in-house that are going to be a night guard that are, geographically are well north of $100 per night guard. For a fraction of that as far as resin, and literally you're allowing the technology to do the heavy lifting for you. The software, the hardware, and the resin. And you come in the morning and you just knock it off. And now with the Asiga, which is what I use, and certainly it's validated in every 3D printing that is used in dental, but in the Asiga they have what I'll show you, a tray that you no longer have to polish now, which I deploy, and it's very, very convenient and easy to do. Now, these night guards come in both a splint rigid and a splint flexible, meaning a soft and a hard splint or a night guard. It's more of a philosophical kind of like preference. I prefer the hard over, or the rigid over the soft. It's a personal thing for me for whatever reason. I feel like if it's the soft, I have the sensation of wanting to bite down even harder on it for whatever reason. So the hard doesn't seem to give me that same kind of sensation. But nonetheless, your dentist can ask for either a hard or a rigid or a soft or a flexible, and you have the opportunity with the Zirlux 3D printing resins to offer that to them in either or. Doesn't really change much as far as the design or anything like that, but it's a rigid material. The rigid that is for required for structural firmness, such as hard splints and night guards. Certainly, anybody that's clenching and maybe, well, the bruxing may be better served with the rigid, where clenching may be better served with the soft or the flexible, but nonetheless, the dentist will determine which output they want, whether it's the soft or flexible or hard and rigid. So it increases the patient's acceptance as well as it's polishable. And now, as I said, it has even a tray that makes it even that much greater, as in the Asiga, as you see here. They have something that's called an ultra gloss by Asiga, which now eliminates the need for the laboratory to polish it. It comes out and you'll see it really, really incredible. Again, it's not just for the Zirlux resins, but it's for any of the clear materials that are validated within the Asiga, as you see here. But you have the ability of just placing in the soft or the flexible, as you see here, and then printing it. And when you see as it prints, it really does a tremendous job. And again, with the ultra gloss, that's different. Now you can use it in the universal tray. The only difference is it won't give you this part as highly polished as you see here. And this is exactly how I nested, where you're literally just flaking it off or pinching it off, and then it's out the door it goes. I'm just checking it to make sure that there's no any discrepancies or anything that is out of whack, and then placing it in the mouth, and the patient is that much happier for it. So imagine having that and being able to come into your laboratory every morning, and especially if you deploy something like the Ultra Gloss with the Asiga, you see it's literally just taking it off of the bill plate, washing it, making sure that you've post cure it and post process it, everything the way it's supposed to be. But you may still have, and again, very little, but if anything, a slight little polish in some spots. But that's it's not very common, and out the door it goes. You just, as long as it's clean, it's post process, it's good. I typically like to keep it for about a little bit, but so that if it's inherent, but nonetheless, it's very easy to be able to fulfill that. So if you're using outsourced services to be able to design it, I'm just going to throw a number. Let's just call it for $5 to $10, and you're using another $5 to $10 worth of resin. And again, I'm being at the higher end. You're about $10 to $20 into a product that is well over $100 in resin. So, and especially if you can do it while you're sleeping at night, you're coming in the morning, that becomes all margin, all profit, and everything that we've always dreamt of in a dental laboratory. So I really, really encourage you. And this is the difference between the two. Obviously, you have the universal or the endurance, which is a general purpose. It'll still do exactly the same. You'll be able to print the night guards. The difference is it won't polish it for you, and this is where the difference is. So here you have, so if you're using Siga or any of the other printers that have a universal tray, this is going to be the outcome, which you'll still have to polish it perhaps with a pumice wheel or anything like that. But when you have an Asiga and you have that tray, this is the way it comes out, which is very, very clean, and I think a great piece of technology. But again, imagine being able to generate a revenue stream, both for your clients as well as for the laboratory, with allowing the technology to be doing the heavy lifting for you. And then it serves the patients. It protects their teeth, whether it's restorative or natural teeth. It really protects them. So as far as I'm concerned, I think every single person, every human being, every patient should be sleeping with a night guard similar to this. It can only serve them well. It can only protect their teeth and maintain the longevity of their teeth. And again, if you're not doing it, ask yourself, why not? I'm a big proponent in technology for it to work for us. Maybe not 24 hours a day, but at least 23 hours a day with an hour's worth of maintenance. If your technology is sitting idle at any point in time, how much money are you making on it? None, right? So you want to think of ways of not only it's better for the technology and especially machinery to operate regularly, but also for the output or your return on investment. The more that piece of technology is operating, the more it is that you're able to return on your initial investment, the better it is the profitability for your laboratory. And this is a perfect example. The surgical guides as well as the night guards a really strong example of how we can still do fulfill services and products that we've done before. But how can we extend that technology to be able to offer more, be able to do more for our clients, to be able to do more for our patients? And these two are perfect examples. So once you print it, you can throw it on the articulator just to make sure. This is the SDL design for it, if you will. You're able to print it similar to the here, and this is universal, and this does require a little bit of, post-processing and finishing. And then you end up with a very nice night guard. I believe this is a hard night guard, if memory serves me correct. But nonetheless, it allows the patient to really be able to have that distance, have that paranormal function taken care of, and really ensure that it's all the way through and it's clear. If you're able, depending on again the build plate, but if you're able to load up perhaps 10 or even more, depending on your nesting, and I'm just going to throw a number and there's $100 profit in every single one. You throw 10 on the build plate, which you can fit more, you got $1,000 right there that's going to build for you. That's going to be there in the morning. So it's a great opportunity and it's something that I encourage you to try. And it's again, not just for the revenue stream, which is definitely a plus, but you're also serving our patients better, and ultimately offering our clinicians an opportunity to treat their patients better and longer and maintain that longevity. So it's really something that is I encourage you again, that both the surgical guys as well as the night guards to really look at these things. Now, when looking at the model print resins, there's two colors that I utilize or that it's available. The Zirlux print resins are available, and they've done that by design or by with thought and meaning. They've only released two colors, and I'll explain to you what those two colors are and why they've made that decision. The one is an ivory, and the other one is gray. Okay, both are identical, just obviously different colors, but they have a light gray and an ivory gray to optimize the shape of detail. They're both formulated for fast printing as well as precise detail, and it allows you to thermoforming release agent if you're still doing like a suck down kind of apparatus. You can still rather print these models either in light gray or in ivory and still be able to use a suck down vacuum form, whatever have you. And it's extensive printer validation. Now, the reason why they have the two different colors and how I use the two different colors is I use the ivory, as you see here, in what I do like as a design mock-up, right? So if you're getting a case, an all-on X case or a restorative case, that's something that, or an aesthetic case, I always lean more towards the ivory rather than the light gray. And I'll explain why. Because the ivory rather, is to the patient is more of what akin to what their natural dentition is. So when you're showing them teeth or a mock-up of what their teeth will end up looking like, when you have a different color other than the color of tooth, they get fixated or stuck on that color rather than seeing the tooth form and shapes of it. So I find that whenever I do a diagnostic for case conversion, a case acceptance, I always lean towards the ivory because it tends to have a significant better conversion rate. But also it's very favorable and sometimes depending on the patient, depending on the clinician, I may do either out of composite or even out of wax. I may put a little bit of where the pink is if we're doing something like an all on X or something like that. So that, again, the patient can see it a little bit even better or more have the envision all the way through even that much greater. So you can see it's got this ivory tooth color look to it, and when it's a little wet, it's even lighter, and when it has like a beigeish kind of tone to it. And I pulled these out because we have the implants in there as well for models, as well as the gingival mask for implants. So it's really a great opportunity for conversions, and you can do that in a great way. The gray is what allows us to then, that's what I use for cases that are aesthetics, that are because I can see very clearly line angles. I can see very clearly on those models on the adjacent teeth, not only line angles, texture, and so much more. So that when the ceramist or myself or whoever is finishing it, I like the light gray because it throws off the light in a great way that I can see texture. I can see the shape. I can see rather than the ivory, which is really geared more for the patient, for conversion, for acceptance of the case, so that it looks akin to what a natural tooth. And that's how I use both. And those are where I select whether I use the ivory or I use the gray. As promised, and if you're doing implant cases, certainly something that I highly again suggest is to have the gingival mask. And again, the Zirlux 3D print resins has that. It's a flexible and durable gingival mask that mimics the natural quality. I mean, it simulates gum tissue. It's easily trimmable, just like what we've had in conventional. But yet now you have it as a low shrinkage, and it's a very, very quick print to be able to output a nice implant model that is really, really something that it benefits in a great way. So again, you have you have the ivory as you see here, the ivory models that you can incorporate the gingival mask all the way through. You have the gray models and the surgical guides as well as the night guards. I highly suggest. So these are the gray models in the light cure, and again, I can see a lot more detail, a lot more occlusion, a lot more anatomy, and it's what we need for our working models inside the laboratory, where the ivory is more for, in my case, for conversions and so on. So it's really a great opportunity, and I think we're close to being out of time, but it's a great opportunity to really look at these resins and really look at the solutions that they provide. And I hope what resonates with you all is the ability of utilizing technology, not just to do what our immediate needs are, which tend to be the way we've done things for the last however many years. But what can you do? How can you do that efficiently, scalability, and repeatably, consistently? But what else can you do? How can you expand the offering, the products and services? Can you do something that is different that you're not doing today, that you can have the technology doing it better, easier, faster? So those are the type of things that I encourage you to certainly look at. The surgical guides, if you're not doing surgical guides now, or if you're doing the restorative on implants and you're not doing the surgical guide, that's a gap that you definitely want to close up. If you're not doing implants restorative, but you want to get into that game, this may be an opportunity through surgical guides to be able to access that revenue stream and thereby getting the restorative as well. So it's really something great. The night guards, 80% of patients are now accepting it, and I think that number is going to go up even more. It's an opportunity, a low-hanging fruit that is really an opportunity for a laboratory to be able to generate revenue in a great way. Again, it's the low-cost way, but yet it's a very impactful and meaningful way that a laboratory can really provide that. Being that it's 3D printed, you may print two night guards for the price of one if you want to be a hero, whatever the case may be. And different business models can offer in different ways. But now you have the technology, you have the software, you have the hardware, which is the 3D printer, and complemented with the materials of the Zirlux portfolio resins, 3D printed resins. You have the opportunity to really be able to excel and propel and progress your laboratory and your offering. So if you're not offering something now to your clients, you certainly, I encourage you to think of how you can. And perhaps from this lecture, from this program, I've given you at least two to three, if not more, opportunities to really contemplate as to what it is that you're able to offer to your clients that would satisfy you, create a revenue stream for you, and be able to offer a better standard of care for the patient, and ultimately a revenue stream for your client doctors as well. So with that said, I really want to thank you all from the bottom of my heart. Really appreciate you being here, and it's both an honor and a pleasure to share with you. And I look forward to if there are any questions.
Yes, so please, we are opening up to questions. I will launch another one of Daniel's questions. We want to know, are you currently offering 3D printed night guards to your clients? So if you wouldn't mind answering that. And while you're doing that, I'll let you know what's next on Zon Academy. Next week, we have simplified digital denture workflow featuring pack dent products, the bond and glaze in one step. And that's going to be presented by Jimmy Stegall. And on 625, we have the clinician's digital workflow, what a lab really needs to know about photogrammetry. And that's with Dr. Isaac Tawil. So that's what's happening on our virtual education. But we do have some in-person education that'll be going on. On July 18th, we're going to be heading over to the new ASIGA facility, and that is in Ann Arbor, Michigan. Again, July 18th, it's a Friday. We will be doing hands-on course on surgical guide with exocad design, Asiga printing of the Zirlux resins. So if you're interested in that, please go to our zondental.com, click on the education link. That'll take you to Eventbrite, and you can sign up right then and there for that course. Again, that's July 18th in Ann Arbor, Michigan. It seems like 100% of our attendees are offering
Excellent.
so the mouth guard. So that's really good. And the next one is, would you like to add Zirlux resins to your laboratory? So if you wouldn't mind answering that. If you're interested in learning more about these, if you answer yes, I can give you a call in the next day or so to discuss how to get a bottle of this resin for you to try into your lab.
So, Fran, on my screen, it came on real quick and then disappeared. I don't know if the same happened in others.
On this one, yes, let me see if I can
Yeah.
relaunch. I may not be able to relaunch that one. I don't know what happened there, but we have, are you
Uh,
looking to add a 3D printer? I don't know what happened with the Zerlux one, but we can if you're interested in the printer, we can definitely talk about that. If you're interested in coming to the course and you want to, talk about adding some Zerlux, we would love to have you and would love to help you out with that. You could also contact your sales representative. That would be really great as well. So we'll just give that just a couple of seconds, and then we just have
mhm.
one more poll. Great. Now, quite a few of you answered yes to getting a new printer. We are now offering 0% financing for 12 months. And that's on all equipment and merchandise, on all in stock and drop ship items. So that's pretty cool. That's really great. 0%, like I said, for 12 months. If you're interested in learning more about that, please answer yes. And I will definitely give you a call, like I said, to discuss it a little further. And I will be able to help you out and get you over to the sales team once we have our discussion. But I want to thank all of you so much for joining us today here on Zon Academy, and I look forward to seeing you all. Up, questions popped up. Let's say, oh,
Oh,
Gabriel wants to say thank you,
oh, thank you.
and he also wants to try the resins. So absolutely, Gabriel, I will give you a call and we can discuss how to get those resins into you.
Perfect.
Again, I want to wish everybody a great day. And thank you so much for joining us here on Zon Academy. And thank you, Daniel, for this great presentation as
Thank,
usual.
thank you, and a
We
very
really
happy
appreciate you.
Father's Day to everybody on Sunday.
Happy
And
Father's Day on
yes,
Sunday and happy CDT Appreciation Month. This is the
yes,
month of June. And we really appreciate you more than words can say. And so do the patients that get your great, restorations and prosthesis every day. You're changing lives every day. So thank you so much for that.
great.
Wait, Dan, I think we have another question.
Ah, yes.
Oh, and Gabriel's saying happy Father's Day to you too.
Oh, thank you so much.
Thank you so much, everybody. Have a wonderful day.